back to Midday. We are joined by pharmacist Misa Manshadi from Manshadi Pharmacy. Thanks for being here, Misa.
Thank you for having us.
As always, you come in with a very important topic, and today it is all about tetanus. And
Correct.
you know, when you think of tetanus, you think of a tetanus shot. But let's discuss what tetanus really is, Misa. How would you describe that? It's a serious bacterial infection, I guess.
Sure. Tetanus is also called Clostridium tetani, and the toxin of this bacteria can cause severe muscle spasms, especially at the neck and jaw, and that's why we also call it lockjaw.
We're looking at some points here on the screen.
That's right. So usually they enter through the body, through the wound or a cut, and they like no oxygen. So the deeper and the tighter the wound is, the better grow. So that's why we say, you know, when you step on the nail, is a good time to do a tetanus shot.
Okay, so what are some of the complications, I guess, that can come along? You mentioned a little bit of, obviously, a severe muscle spasm of the neck, jaw, and other muscles, but the complications, and here we go. Here's some points.
Yeah, it's actually a spasm can be so bad that it can break the bone or a spine.
Wow.
Yeah, and then they can cause blockage of artery, respiratory failure, cardiac arrest, and pneumonia. And sometimes people are unable to breathe when they have so much spasm. So these are some of the complications that can arise as a result of tetanus.
And so how would you know then, Misa, if you had that infection? We'll talk in a few minutes about sort of how you can protect yourself, but are there severe symptoms that you would notice right away, or?
Yeah. The symptoms are usually very gradual, and they come from days to months.
Right.
On average, it takes 14 days to have the symptoms to grow, and the symptoms varies from headaches, fever, and spasms.
Right.
And they come slowly. Yes.
And of course, as you mentioned earlier, caused by a wound or a cut, or as well mentioned on here, any unclean injections.
Correct. Those are
those would be the main things, right?
Mainly, but you know, any cut, even going to a dentist, or even sometimes you can get it from the clean cut as well too. So soil and dirty perhaps areas in the ranch or farms are more cause for concern.
Okay.
Correct.
I know that here in North America, we're pretty protected in the sense that when you're a child, you get that you know, a round of tetanus shots when you're young, and then from there, of course, you can protect yourself every several years. But talk a little bit about how common or not common it is in North America.
It's very rare in North America because we do vaccination. However, the concern comes when we have people that resist vaccination, or when we travel to other parts of the world internationally, and that's where we can get tetanus. Yeah.
Right. So what would you recommend then, Misa, for prevention, for, you know, I guess vaccinations, and sort of what's the timeline there and that sort of thing?
So recommendation is please do the primary vaccines for your children.
Right.
And that's what is very important. Now, if you didn't do vaccination during childhood, or if you don't remember, you can get 3 shots 1 year apart, and you do 3 of that, 3 years in a 3 years 1 year apart.
Okay.
And then you do a booster shot every 10 years. And for the people that did have primary vaccination during the childhood, then they can just do a booster shot every 10 years.
Right, okay.
And we do tetanus shot in our pharmacies, and it's free. So you can just go to the pharmacist and say, you know, I like to have my tetanus shot, and they will give your tetanus. Especially if you're traveling internationally, I do definitely recommend to get the shots if you are, people at risk, perhaps maybe farmers, maybe people that they work in constructions, and yeah, generally everyone actually.
So this, just before we go, Misa, you brought the tetanus shot with you, right? It's really tiny, the little bottle.
Yeah.
But that's all it is, right there.
That's all it is, and it's an intermuscular shot, and you come in and out, and it's simple. Yeah.
Yeah. All right. And there it is. There it is, everyone. The tiny little bottle. We are out of time, Misa, so I'm going to have to let you go. But thank you so much for joining us.
Thank you for having me.
Sort of refreshing our memory on how important it is to be protected.
Sure.
All right. We will be right back in a couple of minutes on Midday. Stay with us.
Thank you.